Professionalism from a CanMed competency to me is incredibly important when we're dealing with a disadvantaged population. Working overseas, I have often had to remind myself that I'm actually an ambassador for often maybe Western or Canadian medicine. And this is not something that you normally think of when you work in a setting where there's, say, no other health professionals, and you might originally think, oh, you're bringing something that that they don't have anything else of, so does it really matter the quality of care you're providing? Does it really matter if you're not perfect? And I would say it does matter. It matters because physicians, we're professionals, and I think in any vulnerable population, the quality of care that you provide is potentially a measure of the quality of care you provide to a vulnerable population is potentially a measure of how you treat the rest of the members of your population. And so I just believe that anyone working in the field of refugee medicine in particular should remember that refugees may have had an enormous number of difficult relationships, difficult interactions with the system before coming to Canada and even in Canada. And so there's an opportunity to be a positive ambassador, because I do believe that physicians care about what refugees like they care about other patients. And I think just being aware of that is really important. It's very dramatic to provide health care to often a refugee, maybe coming from Central Africa, a war zone, a victim of violence, often speaking a different language, having a life experience very different from what we're used to. And I think that this dramatic experience tends to distort our perception of the healthcare needs of a newly arriving refugee and immigrant.
Just to hear these stories from around the world and just these experiences really inspiring of the resilience of these people and how strong they are. And also it's been really frustrating to try to make a bond with them in these 30-minute interviews and using an interpreter, and I've been kind of finding more about myself and how I'm not as patient as I thought I was, and it's just been a really good experience that way.
So one of the things is debriefing is key for medical students, and that this is a medical student experience as much as it is the visitation, first contact supposedly with the healthcare system for refugees. And I think that medical students have their hearts wide open and they can be exposed to very new things for the very first time. And you guys have the HEART program has a wonderful approach to giving constructive feedback on how you interview, but also on, so what did you learn here today? What's out of your comfort zone? Why do you think this is? And what have you learned about X, Y, and Z? So in terms of themes as well, the concept of like what is health literacy, what is cultural humility versus what is cultural appropriateness, and those different things, I think our students could really benefit if we took time to talk about those specific concepts before we went and volunteered.
But as soon as you decide that the patient or the boss is the interpreter, which can happen, then you put your patient back in a more vulnerable position, and that you may not be actually effectively treating your patient, in which case you're not really doing your job as a doctor. So I know that you have to remind yourself that, because you will be confronted, and then in cases of domestic violence, this is actually really obvious, and I think then you don't actually have to necessarily put yourself at risk. As soon as you find a situation where the spouse or the husband or whatever, absolutely refuses any, let's say, quality assurance by using a trained interpreter, you have to just recognize that this is now become a high-risk case, I think, for domestic violence. I would say just not that you have to do anything at that moment, but I just have to say that you have to kind of maybe get information from other cultural experts on the situation. But I think if you have someone that absolutely refuses to allow you access to your patient, I would say you're going to have trouble delivering good care. And you have to say, well, why is that?